Hello, my name is Evgeny Zherebtsov. In this brief talk, I'm presenting results of simultaneous measurements of blood perfusion and fluorescence lifetime parameters in skin of healthy volunteers. Endogenous fluorescence of living cells is a well-known effect, broadly used for characterization of their metabolic status. Using such techniques as fluorescence lifetime measurements, it's possible to record information on the biochemical interactions of fluorescence agents at molecular level. Fluorescence of skin is affected by multiple factors, where the level of skin blood perfusion is probably the most significant one. The rate of blood filling changes the optical properties of the tissue, which leads to a change in fluorescence and complicates the interpretation of the data. Apart that, the blood perfusion affects the metabolism of cells. For reliable measurements, it's necessary to monitor the changes of blood flow in the diagnostic volume of the optical probe. In this talk, we studied the interaction between the fluorescence lifetime parameters measured in the skin by the method of time-correlated single photon counting and the level of blood perfusion evaluated by laser Doppler flowmetry. We have combined both measuring techniques in one fiber optic probe to implement the measurements from the same area of interest. The gender-balanced cohort of conditionally healthy volunteers consisted of 8 people with an age about of 35 years old. For every volunteer, 5 minutes recordings were carried out in the skin of forearm with preliminary degreasing with ethanol. Representative traces of recorded blood perfusion and parameters measured by the fluorescence lifetime channel with an emission filter of 530 nanometers are shown on the slide. The absolute values of the measured fluorescence lifetimes point out that the main detected agent in the measurements were NADH and FAD, both free and bound with protein. The dynamics and shape of the time series traces for the channel 2 with a filter of 530 nanometers differs from the data from the channel 1 with the filter of 470 nanometers. That might be explained by the strong influence of the cellular fractions of FAD in the spectral bands of emission. The intensity of fluorescence demonstrated a high degree of correlation with the blood perfusion intensity, but the lifetime of the first and the second components and the relative fractions in the total fluorescence have shown a minor degree of linear relationship with laser Doppler flowmetry data. Using the approach, we have assessed the individual variability of fluorescence lifetime parameters measured in healthy volunteers' skin with excitation in UV region at 375 nanometers and with the emission detection in 2 wavelength ranges. The recordings were annotated by simultaneous traces of blood perfusion measured through the same fiber optic probe. The presented approach paves the way to the time series analysis of the fluorescence lifetime data and blood perfusion simultaneously in frame of one approach for advanced physiological studies and the development of new diagnostic criteria for medicine. Thanks for your attention. The work has been funded by the Academy of Finland and the Russian Science Foundation.